This is the current drug trends webinar. I think you'll see as we go through just a little bit of an intro, but there will be some newer takes on familiar subjects. It's really, especially with youth, we're sticking to kind of what we know and what continues to be issues within our communities. So again, some of it might look familiar, and there's some new information, and really as it relates to COVID-19, we've added in some of the challenges associated with these trends as well during this pandemic. So we appreciate everyone hopping on. I will just get into a quick introduction on our agency. So, and we have multiple staff on here. And let me also just say that since I'm sharing my screen, I can't see the chat box, but we do have staff monitoring. So if you have any questions throughout, just put them in the chat box. We'll relay them over to myself and Abby, the other presenter, and we can answer those as we go through. So, but we are from the RWJBarnabas Health Institute for Prevention. So we just wanted to take a brief moment to highlight the work of our agency. We do call it IFPR because the name is so long, but the Institute works across the state of New Jersey, offering prevention, intervention, and substance use disorder services. Originally, IFPR has been working to prevent youth substance use for decades throughout the state, and then today, through our comprehensive recovery programs, IFPR perpetuates real change by facilitating effective long-term recovery for individuals suffering from substance use disorder. The Institute is also recognized for training and educational programs serving schools, hospitals, and communities throughout New Jersey. All programs within the Institute are state and or federally funded through grants. You'll see some of just the numbers there on our employees. The Institute has grown tremendously in the last 5 years that I've been with the agency. I think when I started, there was about 14 full-time staff, so you can see how that's really jumped. And you'll just see some of our programs there. I won't go too far into it. But really just addressing the entire continuum of care. And I think that's really the important part about what we do within IFPR. So from our prevention end with our DART Prevention Coalition, which I work on, Communities That Care, Strengthening Families, to really intervention and treatment, with case management and our STAR program, and then really recovery support services with our peer recovery program as well. And I'm sure, many of you are familiar with PRP as well. So next up, that's what I looked like probably 2 years ago. I haven't cut my hair during quarantine, so it's getting long, it's looking good. But as I mentioned, I'm Michael Kapko. I'm the manager of the DART Prevention Coalition. And Abby, if you want to take a second to introduce yourself.
Sure. Good morning, everyone. My name is Abby Thompson. I'm going to apologize if you hear any weird banging sounds. We've been doing construction in my apartment building since the beginning of quarantine. But I am the youth prevention manager, and I specifically work in Ocean County with our DART Youth Prevention Coalitions. So really kind of taking the work that the Prevention Coalition does and turning this into projects within schools in the county, and really kind of having youth-led initiatives to reduce substance use in their schools and communities. I see a couple of my YPC advisors on. I'm so happy to have you guys back. I know school is going to be difficult this year, but we're really excited to have you all here and everybody else on the call. So thank you for joining us this morning.
Yep. And before I forget, so for those of our DART members that are on, thank you for hopping on early. So as part of our DART general meetings, we like to bring in training components throughout the year. So as part of the webinar series, this has become our August training. So after this presentation is done, we'll be having a short DART general meeting with some updates. Everyone is welcome to stay to hear just a little bit about what's going on in Ocean County with our DART Prevention Coalition. That part of the meeting will be very brief. But again, just want to thank everybody for hopping on early. I know this is a little bit earlier than our usual time. So with that being said, I will turn it over to Abby to get into our first topic. And Abby, just let me know when you want me to advance the slide.
Perfect. Okay. So I think that it's kind of no surprise that this is one of the first things that we'll talk about when talking about trends in substance use. Of course, vapes and e-cigarettes. It really kind of has been the predominant issue that we've seen, and really kind of the emerging issue that we've seen over the past 3 or 4 years at this point. So I know a lot of you have seen our presentations on vaping, but we're just still going to do kind of a brief overview of what the products are, what's inside them, and kind of the different things that we need to consider when we are helping youth either not use these products to begin with, or steps that we can take to help them reduce their use and quit. So on the screen, you all will see a picture of some different vapes and e-cigarettes that are out there. So starting on your left, that is a mod. So this is it's more of a tank system. It's refillable. It creates a very large plume of an aerosol. This is kind of what you see make if people are doing tricks with their vapes, things along those lines. And as you move closer and into the center of the graphic, these are our reusable devices that are a little bit more sleek and slender. They don't necessarily produce the same amount of aerosol, which makes them even more appealing to kids. They are battery operated as well. They kind of resemble a Juul, which we'll talk about later, that one in the middle. And then as you move to the right, these are also devices that have refillable tanks. It's another type of vape. A vape is an e-cigarette, is a Juul, is a flare. It's kind of like saying Kleenex as a brand of tissues. The terms are used interchangeably. But essentially, they all kind of do the same thing. They're all battery operated. They're not necessarily regulated very carefully, which means that there can be issues with their safety in terms of how they're produced and distributed and kind of what's inside of them. But again, they all kind of work in the sense that they are rechargeable devices and they produce varying amounts of aerosol, which kind of determines which product a teen may choose to use versus an adult vapor. Mike, you can go to the next one. So what's inside, and this is typically the main ingredients in any of the juices that you would find. That's what they are called. Instead of, a cigarette, you have your traditional sense of what it looks like. What goes inside a vape is called an e-juice or an e-liquid. Again, that term is interchangeable. But basically, there's the four main ingredients, which are propylene glycol, vegetable glycerin, flavoring, and then liquid nicotine. So the propylene glycol and vegetable glycerin, they are food grade additives. They are generally recognized as safe by the FDA. They're chemicals, they're oil-like mixtures, and this is kind of what producers mix the flavoring into as well as the nicotine. So this is the majority of what is inside. It's kind of the base that is used to kind of cut the flavoring and the nicotine as well. So we'll talk about flavoring in a moment, but just in terms of nicotine, and this is something that the FDA has cracked down on a lot more. The juices come in varying concentrations. So you can buy pre-mixed juices. You can buy pods that click into some devices, like the Juul or Soren Drop. They have pods that click in. And then you can also go to a vape shop, which I don't necessarily think people are doing as much anymore because of the quarantine, but you can also get a juice mix specifically for you, which then kind of impacts the concentration of liquid nicotine that is going into this product. So because there's such a wide array of where you can buy juices for your device, it can be kind of hard to know what exactly is inside. It's not necessarily labeled, and we also know that sometimes kids mix their own, and adults will mix their own liquids to go inside their vapes. So this also means that you really aren't sure how much nicotine they're necessarily taking in. You can go to the next one. So this is from a survey that was done in 2018. This was a nationwide survey, and they found that 68% of e-cigarette users who were teens and in high school were using flavors. So the flavors kind of run the gamut. And if you guys want to type into the chat box, what are some flavors that you guys have heard of, or what do you think is the most popular flavor from those of you that work with youth? And I can see the chat box. So if you guys just want to type this in, you've heard of them. I know like unicorn puke was really big for a long time. There's lots of different flavors out there. All right, well, Mike, you can click, fruity, fruit, sunset breeze. Oh goodness, that's a new one. I haven't heard that. Fruit, okay, they're all coming in now. Green apple, that's a new one that I haven't heard. Dessert flavors are likely to be appealing to teens, yes. Fruity pebbles, that's another one that I've heard. Yeah, absolutely. So all of these are different flavors that are out there. The most popular flavors was mint and mango when this survey was done, but as you guys can kind of see from all your different responses, that landscape has completely changed. And this is really purposeful, targeted marketing and product development that is done by the companies that produce these products, because they know that teenage brains are hardwired to prefer sweetly flavored things. A lot of the flavors are reminiscent of, walking down the cereal aisle, or maybe going to a baseball game if I'm going to get cotton candy and lemonade with my family, or a county fair. And I also saw that, Dawn, you wrote in disposable. So we are definitely going to talk about the disposable vapes in a little while, because this is one of the most recent trends. So again, it kind of runs the gamut, but this is something that we saw happen with single flavored cigarettes. And the FDA stepped in and banned these because they knew that they purposely targeted young people. So we kind of see that same thing happening again with all of the different thousands and thousands of flavors that you can get for e-liquids and e-juices. Awesome. All right, go to the next slide. So I'm not going to actually spend that much time talking about Juul. And again, we're kind of just doing an overview, but this really is the product that made this a large issue in our schools and our communities and amongst our kids. Juul's hit the market. They had over 50% of the market share for a very long time. So that really kind of catapulted them into anywhere kids are. It was very easy to get these products. They weren't regulated. You could buy them with coupons and Groupons, special deals, things along those lines. Kids were renting out their Juuls for, just kind of a single puff of them, something as simple as that. But that, because of the way Juuls are designed and how potent their e-juices are, this really kind of accelerated the pace at which kids became dependent on these products and used them quite regularly. So Mike, if you can go to the next slide. And you'll kind of see this here too you can, I think, see it a little bit better in this graphic, that the Juul and a lot of the products that have come after it look like a USB. And this is purposeful as well, that it kind of looks like a new Apple product, something else that you might want to ask for Christmas, because it's sleek, it's appealing in its design, and it looks much cooler. And I'll even say that it looks much cooler than the cigarettes that it's next to in this graphic. But just because it looks like a tech product, it doesn't mean that it is any safer than a traditional cigarette. And it also doesn't mean that it doesn't contain nicotine, which is one of the biggest issues that we faced at first, that kids really were not understanding that these products contain nicotine when they first started using them, which was another major component of the marketing campaigns that went on by big tobacco companies and the companies that were producing these products. So in fact, and I know I mentioned to you all before that these products have varying levels of nicotine concentration, but on average, one Juul pod has the same amount of nicotine as a pack of cigarettes. So this is a really big issue when it comes to how we look at kids using these products, and teens, adults, anybody using these products, as compared to how they might use a traditional cigarette. So a lot of smokers or former smokers will tell you that they look at their pack of cigarettes and say, okay, I've had 3 today, and use that to kind of monitor how much they're taking in, versus if you're sitting there playing Fortnite or Minecraft or Roblox or whatever the new game is that kids are playing, or they're socializing with their friends, or in school, whatever that is, they're not monitoring how much they're taking in from these pods. So one pod has about 200 puffs, but I can guarantee you they're probably not counting. And this means that they're taking in that nicotine at a potentially much faster pace. They also don't have to go outside to use these products. It's a lot more discreet, which is kind of another big difference in the way that they are used as well. So the sleek design, the limited production of any sort of aerosol that comes out, the lack of smell that might kind of, some of these products smell, some of them don't. All of these different factors, in addition to the very high nicotine content, makes it a really big issue for youth in terms of how quickly they may become dependent on the products as well. Mike, can you go to the next slide? Awesome. So this is kind of what I was just saying. And this was kind of from at the beginning of research when people were trying to understand how these products were impacting teenagers. So they were looking at their use. So one of the studies found that there were teens that were smoking a pod a week. And if you're looking at that over a period of time, in 5 weeks, that's about 100 cigarettes, which is then considered person is then considered an established smoker. But we've had reports, and I know there's a lot of SACs on here and people who work with youth in direct care that are smoking 1 pod per day. So there goes that 5-week time frame if you're kind of looking at how quickly this can become an issue. So this is definitely something else that we need to consider and be aware of how quickly this addiction to nicotine can happen. Mike, you can go to the next one. All right, so these are some of the other popular products that we wanted to touch on. And if you guys have heard of any ones that I don't mention, please put them in the chat box because we rely very heavily on your insights. And I always tell the kids that they keep me relevant because I hear what's going on from them. So these are some of the other products that we've seen on the market, products that kids have told us about that are popular. So we have flares, smock, Soren drops. Again, you'll kind of see that these look like tech products. They're sleek in design. They kind of look like USBs. It might be hard to, distinguish between, is that a wireless mouse that my kid has in their room or is that a Soren drop? So that's just kind of something else to look out for too, that this is another purposeful component of that marketing. So Mike, you can go to the next slide. There's also Enjoys, Miley's, Ruby Candy Pens, My Blue, and a lot of these products also, specifically the My Blue, are electronic cigarette versions of traditional cigarettes, in the sense that the companies that, like Marlboro, they've put out their own version of an e-cigarette because they know that this is where the market is going. So just kind of something else to consider. It's all the same companies and individuals behind this production. Okay, so then on to the single-use vapes, which is what somebody mentioned earlier in the chat box. So there is a product called Puff Bars that has become very, very popular over the past, it became popular before quarantine really kind of became an issue and really kind of shut us down in March. But basically, these are single-use vapes. They are much cheaper. And it is therefore a little bit easier for teenagers who may not have a job or the budget to work with to buy these products. And they are disposable as compared to rechargeable. So these are definitely a big issue because of how easily they are accessed, and then also kind of that throwaway component. Mike, can you go to the next slide? Thank you. But there is some good news. So the FDA did recently step in and they are working to regulate the flavored disposable vapes because they kind of saw that they were taking the same path as the rechargeable ones that we saw as an issue at first. So just a couple of weeks ago, I guess actually almost a month ago, time doesn't feel real anymore. The FDA announced that they sent warning letters to 10 companies, including Cool Clouds Distribution, and they are the company specifically that works with Puff Bar. So essentially, these disposable and the single-use vapes and their e-liquids themselves, they didn't have the required pre-market authorization that was needed, so they were really out on the market when they shouldn't have been, and this is kind of what the FDA used to pull them. So they have, it's not immediate, they have a certain amount of time to do this, but that's kind of what they're pulling them on. And there were also 3 companies, including Puff Bar, that were illegally marketing these products. So this was something else that the FDA was able to kind of get them on. And then there were some other companies that aren't necessarily as popular, but they were cited for marketing unauthorized e-liquids that imitate food packaging like Cherry Coke and Cinnamon Toast Crunch. So earlier on when somebody mentioned, Fruity Pebbles, things like that, they really have made these e-liquids resemble products that kids are familiar with, that they might enjoy, and that just kind of makes that enticing nature of it even greater. And again, is something that we have saw with big tobacco and decades before, and that we really need to address specifically with these products. Awesome. All right, so we're just going to briefly go over some stats related to adolescent nicotine use. So again, and I kind of mentioned this, we've seen the sharp decline in the use of traditional cigarettes over the past decades. And this is really the result of the work that schools have done community members have done, policy has done, prevention has done, that we really kind of have a grasp now on how nicotine can impact the developing body, the developing brain, and how important it is to prevent that use early on so that we don't have individuals becoming lifelong smokers. So I think it's 3 out of 4 adult smokers started before they were 18. And this really, again, it all ties back to the way the brain develops and what happens when you introduce nicotine into that brain that's still malleable, still growing, and then becomes dependent on that substance. So we had that very sharp decline from about 20%, specifically if we're looking at seniors in high school, all the way down to about 5.7% in 2019 for traditional cigarettes. But on the flip note, and Mike, if you can go to the next slide, we've seen that really sharp increase in the use of nicotine through vapes. So these numbers are from 2019, and the most recent look at what high school seniors are doing, we had 25.5% of high school seniors saying, this is nationwide, that they were vaping, they had been vaping in the past month, and were using nicotine in this manner. And about 12% of kids who were seniors were vaping on a daily basis. So again, we had that really sharp decline in the use of traditional cigarettes, but it really spiked back up in terms of vapes. And again, it's the same chemical that they're taking in, just kind of in a different delivery format. Go to the next one. And this is something else that I think is really important to point out, especially in the time of COVID and everything that's kind of going on in our world. So when kids were asked why they were vaping, about 60% of them said to experiment, to see what it's like. That's not really any surprise, just kind of based on teenage experimentation and the way kids use different products. 40% said because it tastes good, which unfortunately also makes sense because of the flavors and what we know about that. A little bit under 40% said to have a good time with my friends, which also we know is one of the big components when it comes to teenage substance use, using it in a social setting, and then also the peer pressure component that comes in. But the one that I really wanted to point out is that fourth one that's in from the left. And this is just under 40% of kids said this was a reason, and it was to relax or relieve tension. So the responses for this question, they've increased by more than 1/3 from the previous year. So they've seen a really sharp increase in this being one of the reasons why teenagers are vaping. And we know, I know there's a lot of folks on here who are in the substance use and mental health world, that how those two are interrelated. So kids are seeing vaping as a way to relieve their stress, to relieve tension, anxiety, depression, anything else that might kind of be going on in their life, and using this as a coping mechanism, where in reality, we know that that is not the best thing for them. Just kind of in terms of we need to help them build healthy coping skills, deal with stress, anxiety. So I think that this is especially important in the time of the pandemic, and as we head back to school and all the different stressors that are going to be associated with that, that even if it's not vaping, that we definitely need to keep an eye out for trends in substance use, because it is being used as a coping mechanism by our kids, and this is something that we need to be prepared to address, especially when we're in a time of collective grief and really kind of a shared historical trauma that's going on. All right, Mike, next one. So have you all seen any changes in vaping during COVID-19, either amongst your kids, your students, the youth that you work with? I know that we're kind of in summertime. I heard some reports initially that there were some kids that kind of had to quit or went through kind of like a forced withdrawal because they were no longer able to go to school and purchase a Juul or a Puff Bar or whatever they were using, or that source was cut off because they were locked down. But I also have heard on the other side of things that there has been a really big increase in the number of kids who are vaping because they're using it as a coping mechanism and just to kind of relieve tension. So if you guys have heard anything, feel free to drop it into the chat box. We would love to kind of hear what you're seeing from anywhere throughout the state, because I know we kind of have a wide array.
Hey, Abby, quick thing before we move on, because I know it's a little bit of a shift. So there was a question in the chat box. Have you guys done the vape training virtually yet with youth? Are there any guides on how to adapt some of the activities to virtual platforms? So I feel like you could probably answer that best.
Yeah, absolutely. So we did do a virtual training. I did one at least myself at the end of last school year with a couple different schools. And I think one of the things that's really hard, and we, of course, I have the utmost respect of all the different school personnel that I work with right now, and I can't imagine how difficult that is. And I think that we understand that every school district kind of has a different way to go about this. Some schools are able to invite us into their Google Classrooms, their Zoom meetings, things along those lines. But privacy changes from district to district. So for schools that are able to have us come in and kind of do that training with health classes, we have absolutely done that. Some schools have opted to kind of have all the 7th graders on, or it's an optional meeting that they can log on to and have hopped on. We did all the 7th graders and all the 8th graders and all the 9th graders, just kind of in one district. So we definitely have adapted it. It's pretty easy to kind of share the screen. Unfortunately, it's not as interactive as I would have liked it to be, but it definitely is something that we can still do. And we are planning and have plans to still run our youth prevention coalitions virtually for schools that are interested and able to. And then also we'll kind of be doing a larger countywide, at least for Ocean County, youth prevention coalition format so that we can get kids on who may not have the opportunity to in their schools because of the way restrictions kind of are. So the answer is we're working on it and it is possible. It's just kind of dependent on the program or the school. But Ashley, I can definitely kind of, I'll follow up with you because I know you're in our marijuana and tobacco work group and kind of have been focused in on that. So I can follow up with you to work out specifics. Whatever works for you guys is really what we're trying to get at. All right. So in terms of vaping of other substances, this is kind of something else. And as we discussed, one of the other trends in substance use, of course, the use of marijuana has very sharply increased as well, especially amongst teens and in the form of vaping. So Mike, if you go to the next slide. So marijuana, of course, can still be smoked traditionally, but it can also be vaporized. And this is definitely a growing trend among teens and young adults. This has been growing in popularity in states that have legalized recreational marijuana. It really isn't necessarily too new, but what is new, and I think this is just kind of because vapes that somebody would use to smoke nicotine kind of entered the school environment or the community environment or the workplace. So have cartridges or pods, tanks, whatever you kind of want to call it, that contain marijuana concentrates. So there are absolutely marijuana vape pens that can be easily concealed. And in the same way that a vape may not produce a large plume of aerosol, they produce little smoke. And sometimes they don't produce a smell. Some of them do. I have certainly, been in, well, not recently, but I've been in crowds at concerts, even on the beach, and have seen people use them and kind of get that whiff after and know that's what people are doing. But they don't necessarily produce that in the same way, which makes it really, really difficult for people who are around youth to identify this youth. And for those states that have legalized recreational marijuana, the cannabis oil cartridges or the marijuana concentrate cartridges are the fastest growing segment of that market. So this really isn't going anywhere. Next slide. So this is just kind of a picture of what some of them look like. You'll see that these kind of resemble, when we are think back to that image we saw earlier, what's on the right side of the screen, kind of those refillable tanks, but the oils don't necessarily look any different than an oil that contains nicotine. One. And we know that marijuana concentrates may contain significantly higher levels of THC than your normal high-grade marijuana. And as a result of this very extreme and high potency, this can cause hallucinogenic and psychological effects. So as a result, teens may experience difficulty thinking, problems with memory, lower IQ, depression, anxiety, and other mental health disorders. I think one of the other important things to point out here, again, I don't know if this has been if this has really kind of been an issue over the past couple of months just because people aren't in school, or they aren't necessarily seeing the large groups of friends that they may have before. And I know that we have some of the SACs from Ocean County on the call right now, but I know that there have definitely been instances when schools have reported and parents have reported that kids have accidentally used a vape that contained a marijuana concentrate or another substance without realizing it. So a lot of times there could be somebody who's using a vape from a friend. They think that it's nicotine, that's what they're told, and they end up using it and then they end up high. So this is something else that we kind of need to be aware of and understand. And when you're having open and honest conversations with the kids that you work with your students, with your own children, it's just kind of being transparent about the fact that you don't necessarily know what's inside those cartridges. You might not be able to smell it, you might not be able to see it, and that definitely is a risk as well. And I also see a comment in the chat box that there's also been CBD and synthetic marijuana products in sweets, creams, or oils for intake available. So absolutely. So CBD is, and I don't think we have anything on CBD in this presentation today. CBD is legal in the state of New Jersey. There's a lot of different caveats that come with that, and the where people buy products, what's in them, and kind of the levels of allowable THC in different products. It varies. They're not necessarily tested. So we really encourage folks to kind of do research on CBD on their own and kind of understand the potential impacts of that use. But there also absolutely are other products such as brownies, cookies, gummy bears that are considered marijuana. They're edibles, and they have these similar concentrates in them. So thank you for that comment. Definitely another one of our major concerns, especially as we look at legalization potentially happening in New Jersey. All right, and then just very briefly, to look specifically at daily vaping of THC for teenagers. We had about 4% of 12th graders, 3% of 10th graders, and about 1% of 8th graders. But when you look at past month use, these numbers are much higher. So again, we've seen a really sharp increase just from 2017 when this information was starting to be collected to 2019. So this is definitely a growing trend and something we need to look out for. All right, we're gonna blow through these super quick because I know for the sake of time too. So in the news, what does vaping kind of look like in terms of nicotine or in marijuana concentrates, no matter what's in there? So a lot of you may have heard the term EVALI. So about, I guess it was last summer at this point, there was a whole slew of folks that started to have this very strange lung illness, and doctors around the country were trying to kind of pinpoint it and understand what it is, what caused it. So they ended up calling it EVALI, which stands for e-cigarette or vaping product use associated lung injury. And when they looked at the cases of those who were hospitalized, the majority were male, and over 50% of the patients were under the age of 24. So I think that that's just really important. And 37% of them were 18 to 24 years old. This was really kind of targeting that young adult, the kind of mid-20s age range, but then also a significant proportion of kids were also under 18 years old. Go to the next slide, Mike. So when they finally kind of took a look and got information out of those who were diagnosed with this condition, 82% used THC containing products. About a third reported exclusive use of THC containing products, but there also were a fair number of individuals, over 50% reported using nicotine containing products, and 14% were exclusively using nicotine containing products. So it really has kind of been tied back to those vape products that contain THC, which would be those marijuana concentrates that we see out there. But there definitely was also that dual use. And you also have to imagine, did that use start with a nicotine containing pod and then transition over to THC? How did that really go? Those aren't answers that we necessarily have, but especially for that younger age of kids is something that we need to be considering. If you go to the next slide, Mike. So the other thing to point out, they did pinpoint, and this is the CDC, and lots of different other organizations around the country that were monitoring this, that the THC pods that individuals were using, most of them had an ingredient called vitamin E acetate in them, and this was also traced back to the lung tissue of those who were sick. So essentially, they have identified this as the main chemical of concern for this specific lung injury associated with vaping. This is not to say that there aren't other chemicals of concern. This is not to say that there aren't other chemicals, including nicotine, formaldehyde, lead, volatile organic compounds, a whole bunch of other things that are also potentially harmful in these devices. But for this specific injury, vitamin E acetate was identified. Next slide. In New Jersey, and this kind of happened in the middle of quarantine, but there was a ban on April 20th of flavored vapes that went into effect. So this was signed in January, but finally took effect in April. So this really should kind of decrease teenage access to these products. You can go to the next slide, Mike. And something else again that we wanted to point out as we're kind of in the middle of the pandemic, sorry, have a tickle. So we do know that there is a risk between, Mike, can you take over for a second?
Absolutely. I was going to joke, is it vaping or COVID for your tickle, but I'm joking. No. So, and you know, this was a slide that was in here when we did our last round of a webinar series, and you'll see on the next few slides that this is actually, there's been more research and this has grown more. So, you know, at this point, it was just kind of an assumption, obviously, that with vaping impacting the lungs and COVID impacting the lungs as well, that there was a connection to that. So just to read the slide so I don't, you know, so I get the information correct. So here's what we do know. COVID-19 causes significant inflammation of the lung tissue, and the pre-existing lung inflammation and damage caused by smoking or vaping can compound the effects of the virus, putting individuals at risk for serious complications and death. On the flip side, I know that there was a kind of an unsubstantiated claim that smoking and you know, the nicotine and everything in your lungs would actually protect you from COVID-19 because it was a coating in your lungs. Obviously, as you'll see in the next few slides, research definitely shows against that. But I know that that was out there a little bit in the beginning. So then the bottom, it's already well known that smoking and vaping can lead to irreversible lung damage. According to the CDC, if smoking continues at the current rate among US youth today, 5.6 million Americans younger than 18 are expected to die prematurely from a smoking-related illness. And that's not taking into account the new concerns around potential complications from COVID-19. And I think that's a huge point to make at the end. You know, there's still obviously so much unknown about COVID-19. So, you know, these are some preliminary studies that we're going to go through. But, you know, obviously not worth the risk, you know, coupling that with smoking or vaping.
I'm back, Mike,
so,
and thank you for those who came to my defense in the chat box. That was not a funny joke.
Oh no, I didn't even read the chat box yet.
No, it's okay. It's okay. So this is one of the studies that Mike just mentioned, and it came out of the Stanford University School of Medicine, and they did a study of 4,300 individuals. They were between the ages of 13 and 14. And again, kind of from those numbers that we've seen and previously with the volley, that this is kind of the age range where we're seeing a lot of this vaping occur. So they found that teens and young adults who vape are 5 times more likely to become infected with COVID-19 compared to those who do not vape. And this was kind of drawn back to a couple different theories as to why. Those who vaped and smoked combustible cigarettes were nearly 7 times more likely to be infected. So it's kind of on that same side. It's the same product, similar use in the way, similar ways that these products are used that may kind of increase that risk of spread. Those who use both vapes and combustible cigarettes were 5 times more likely to experience COVID-19 symptoms such as coughing, fever, tiredness, and difficulty breathing. And this is also consistent with previous studies on vaping and how this may negatively impact somebody's immunity. So definitely they're starting to see a connection between the use of vapes and the use of traditional cigarettes an infection with COVID-19. So Mike, if you could hop to the next slide. So in terms of kind of understanding why this might be the case, the folks that were conducting this study hypothesized that teens and young adults tend to share their vape, which we have all seen occur in classrooms, in our homes, on school buses, in the community, and this can increase the rate of transmission. So even though we're all really kind of supposed to be in lockdown at home, this was still occurring. Youth are still hanging out with one another. This may occur as the result of restrictions being lifted or just kind of still hanging out. And when that hanging out happens, there could be vaping going on. So vaping also causes you to touch your face. So if you think about it, one of the number one things that we're supposed to be doing right now is washing our hands and being careful of how often we touch our face, because we know that this can spread germs. So if you are vaping or using a traditional cigarette and bringing that up to your mouth, this is really kind of offering a direct pathway for the virus to enter your body in the case that it is on your hands, the vape itself, anything like that. And we also know, and this is something that they've also said about cigarette smoke, that vapes produce an aerosol, so cigarettes produce smoke. And the aerosol that the individual exhales back out may contain micro droplets of the coronavirus that can get carried over 6 feet. So this is also something that's interesting. I know I've kind of seen lately that they've been encouraging people to stay away from smokers and also from people who are vaping, because even if you're not vaping or smoking yourself, if you're walking through that cloud or walking through that smoke and that person is an asymptomatic carrier and has the virus in their body, that you may also kind of inhale that yourself. So just kind of something else interesting to consider. And again, this is new information. We don't really understand the impacts, but this is something that we are continuing to monitor, and I believe that we all need to monitor, especially as we kind of head back to school. All right, and then the last thing on vaping, and this is again kind of keeping in mind vaping of nicotine products as well as marijuana concentrates, one of the most important things to do is to get informed and stay informed. So there are definitely things that we've learned that are new, and this presentation has kind of changed a little bit over the past couple of years. A lot of the information has stayed the same, but there's always kind of a new product that is out there and something that we need to be aware of, like those disposable products. I think that they'll continue to be around for a little while, but there's going to be something new that comes up very quickly. And again, talking with kids and young people, having an open and honest conversation. This is something that they see on social media, amongst their friends. They see it just about everywhere. So they're aware of it, and it's really important to kind of open up that flow to have an honest conversation. If your child's school or the organization you work for, if you work with kids, make sure that they are aware of the policy that you have in place, and make sure that your child is aware of the policy that their school has related to vaping, and also if there's any town ordinances. So a lot of towns have kind of stepped up and put in additional ordinances on the books to kind of help the community deal with this issue, and some of those carry a large fine or the requirement to volunteer. This might be something else that would deter kids. And then most importantly, linking young people who need treatment for nicotine dependency with treatment services. So Mike, if you can go to the next slide. So this is definitely something else, you know, just suspending a kid, or just if it could be at the point of expelling them, or just kind of different punitive approaches will not do enough to kind of address this issue. We need non-punitive approaches and supports to really kind of ensure that we are helping those kids who are already vaping to stop and really prevent them kind of from becoming an adult smoker. So one of the resources that we have, in addition to the Quit Line in New Jersey and some other resources through the Truth Initiative, things along those lines, through the Institute for Prevention and Recovery. Mike mentioned this earlier, we have the Nicotine and Tobacco Recovery Program. So this is a program that is still going on during the COVID-19 pandemic. They've switched to a telehealth format, and they still are seeing youth. Nicotine replacement therapy is provided for free to adults who participate in the program. It is not necessarily provided to somebody who's under the age of 18. This is all evaluated on a case-by-case basis, but this is something that is still going on. And if you know youth work with youth, anything like that, or adults who you think would benefit from this program, we encourage you to give that number a call, or just kind of navigate right to that webpage. You can fill out a form and somebody from the program will be in contact with you, or the individual gets some more information and then kind of point you on the way to getting support that is needed. All right, I'm going to turn it over to Mike now. He's going to talk through.
Great, thank you. You know, and again, I know the vaping topic is still a hot topic. And as I mentioned in the beginning, you know, we want to cover ones that, you know, as trends come and go, like vaping, you know, there are still the overall trends and the long-term trends that kind of remain. So, you know, we wanted to touch on those as well. So obviously one of those being prescription medication misuse and the opioid epidemic. So we just wanted to kind of give some updates on that. You know, I think some of the information might look familiar, but really you'll see as we go through, you know, we want to focus on not just defining the problem, but access points, new information, things like that. So just a quick update. So you see here, and this is from 2018. So these are the most recent numbers that are available, but just as 5.4 million people have used prescription medications non-medically in the past month and 16.9 million in the last year. So, you know, still an enormous problem. You know, so much is being done to address the opioid epidemic and innovative approaches. Obviously, we are most familiar with Ocean County and the great work that's been done there, but I know New Jersey has really taken a lead, I would say, across the country in addressing the opioid epidemic. So, you know, these are still high numbers, even with all of the amazing work that's been done. So I think it just really shows the scope of the problem and that obviously the work needs to continue. So that's the same number on the bottom, but what I wanted to point out, and this is actually an updated piece of information because there was old information that showed every 4 hours, but basically what this says, there was enough prescription painkillers prescribed to medicate every American adult every 3 hours for 1 month. So just an incredible amount of medication that's been put out there. And we'll talk a little bit about where that unused or unwanted medication sometimes winds up and really where it should wind up. You just see there on the bottom, the top 3 categories of the most abused prescription medications. So painkillers, you know, almost double that of tranquilizers or stimulants. So really, you know, that is still the #1 issue with opioids there. And I think this is really the important part. So these are access points. So you see there 51.3% of people reported that they were given by, bought from, or taken from a friend or a relative. So I think it's changed over the last few years, but I think there was that notion of doctor shopping or buying on the street, which, you know, obviously still occurs to a certain degree, but really this is, you know, the biggest access point, friends or relatives. And I think that's really the important steps as community members, that's the role that we can play in addressing this epidemic. And you'll see here, I always like to include this slide. This just kind of shows that natural progression, unfortunately. You know, I think that what separates the opioid epidemic from other drug issues and even epidemics like with cocaine in the 80s or ecstasy at the turn of the century, I think what separates it is that so many times this begins for legitimate purposes. You know, people going in for surgeries or having an injury, things like that, being prescribed these pills and then really being unable to get off of them. You know, that's really another reason why we see the demographics across every age group with this epidemic. You know, it's not a recreational use problem that we tend to associate with younger people and partying, things like that. This is really just so much across the lifespan, because when people are in their middle ages or elderly and they're going in for procedures and being prescribed these pills, that's where there's still that risk of becoming dependent on them. So part of the problem is, you know, when you run out of your prescription, where do you turn now that you are physically dependent on these drugs? So, you know, to go out on the street to buy opioids, it's typically $1 a milligram. There are some forms of oxycodone out there that are 80 milligrams. So you can imagine, you know, paying $80 for one pill when you need 2 or 3 just to maintain, you know, kind of being able to get up out of bed every day. You can see how that becomes a very expensive problem very quickly. So unfortunately, The much more cost-effective turn to take is using heroin that only costs $3 to $5 per fold. So that is really, you know, unfortunately the next step that people go down. And I think so many times you hear that, you know, like, I would never do heroin. And then it becomes, well, I would never inject heroin. And then all of a sudden, when you think about the cost and you think about still chasing that high, really, I think people find themselves in situations and doing things that if you ask them several years before, they could have never imagined themselves in that position. And then there, obviously, heroin still being imported and cut and mixed. You know, there are issues. I'll talk about fentanyl a little bit, but that is really what leads to overdose. You know, not knowing what the purity of the heroin or what you're taking is. You know, with prescription drugs, not that there is any silver lining, but at least that is, you know, prescribed by a doctor, filled at a pharmacy, and you know exactly what you're getting. Where obviously with heroin or other street drugs, you know, that can be a wild card and lead to overdose much easier. That bottom point there, I just want to mention, you know, Narcan is a fantastic tool that is at law enforcement's disposal, first responders, and the community's disposal as well to address this problem, but it is definitely only one piece of this puzzle. You know, it rectifies the situation immediately in that moment, but the important part is really the follow-up and obviously getting that person to access appropriate services for, you know, to address their substance use and opioid use disorder at that point. So some of these slides are from a young athlete's presentation that we give, and I know so many of us work with youth or have our own children, so you'll see that as we kind of intertwine this, and I think it makes it so much more relevant to those, you know, to those on here, you know, with younger kids and especially ones that play sports. So you kind of see this intertwined here. So I won't touch on the top one, but nearly 7,000 Americans initiate medication misuse or abuse every day. And this also includes 2,500 young people between 12 and 17 years of age trying a prescription painkiller for the first time. And 4 out of the top 5 drugs misused by 12th graders are prescription or non-prescription medications. So this kind of gets back to the more general idea. So this is a statewide look from, obviously you see there the years 2013 to 2019. And this is all publicly available data. It's really interesting to kind of track the trends, and it breaks it down by county. But because this, you know, our webinar really, we're trying to reach as big of an audience as possible, I included statewide numbers here. But on the top there, you'll see suspected overdose deaths, which you can see between 2013 and 2019 have more than doubled. Naloxone administrations, which have continuously gone up year after year since it first became available 2014, 2015. And then you also see opioid prescriptions going down significantly, from 5.2 million in 2013 down to 3.9 million, about 4 million in 2019. So with that being said, and so many programs and tools available, we see Narcan administrations up, opioid prescriptions down, but the overdose numbers are remaining the same. And actually, you know, if you compare it to just a few years ago, they're still going up significantly. And that is really where, as I jump to the next slide, that is really where fentanyl comes into play. You see there next to this penny, that is the amount of fentanyl that can lead to a deadly overdose. So when this is cut in with heroin, whether it's done on purpose, you know, by a dealer because they want to sell a product that gives people a better high and wants them coming back to them to continue to buy, or whether just, you know, from the chain of production to the dealer. I apologize, I think I got cut off. I'm glad I'm on my phone too. My Zoom is reconnecting on my computer, so just give me 1 second. Abby, do you want to try to share your screen as I reconnect? Sorry about that. Are you good to do that moving forward, Abby? Okay, so anyway, I apologize. I'm going to try to reconnect on my computer as well. So as I was saying, so, you know, along the lines of production, this could be folded in anywhere. And obviously the user doesn't know what they're getting. You know, they're thinking they're buying heroin, and only heroin. They use the amount that they typically use, that they know that, or they feel that they would be safe using. And then it becomes, you know, a much bigger problem with fentanyl. You can go to the next slide. Oh, thank you. So, just a few facts about fentanyl. So it can be up to 100 times stronger than morphine. So you think about that picture that we just saw, and how deadly that can be from just a small amount. Nationally, the death rate from synthetic opioids such as fentanyl has risen 1,125% between 2011 and 2017. The DEA reports fentanyl remains the primary driver behind the ongoing opioid crisis, with fentanyl involved in more deaths than any other illicit drugs. And you see there in 2018, there were 412 overdose deaths in New Jersey from natural opioids such as hydrocodone and oxycodone, and 2,219 from synthetic opioids like fentanyl and tramadol. So there has just been a shift over several years. You know, if we went back and looked at numbers from 2012, 2013, fentanyl would most likely be non-existent or very minute. But it has really taken over, you know, the majority of overdoses we see here in New Jersey. Then just as I mentioned, heroin may be cut with fentanyl, therefore users are not purposely taking such a stronger substance. Next slide. And so this again is from our young athletes presentation. So the majority of teens report that prescription drugs are easier to get than illegal drugs. And many believe that misusing prescription drugs is much safer than illegal street drugs. And that really lends itself to the fact that, you know, we know that 4 out of 5 people who wind up using heroin started out with a legal prescription from a physician. So again, this could be post-op, a result of an injury, medical procedure. So that has really led to this kind of becoming a more legal drug problem than just illegal. And so with all that being said, and the numbers nationally are astronomical, but that has led to drug overdose now being the leading cause of death in Americans under 50. And I have to say, I'm curious to see how COVID impacts these numbers next year. You know, not that even if it drops to number 2, not that that's anything to be proud of, but obviously, you know, COVID has had such an impact on our lives, and we will talk a little bit about how COVID has impacted substance use overall towards the end of the presentation. So next slide. One of the biggest things here, and the important part also, is that this is what we preach to middle schoolers, high schoolers. It's not just about prescription drug misuse or heroin use, but this is really, you know, introducing any type of substance into the brain. So the human brain is not fully developed until the age of 25. So as youth become dependent on these substances while their brains are still developing, they are obviously going to continue to be dependent on them, and it would be that much harder for them to stop as their brains are still fully forming. So next slide. And I just want to make the point here, this is really where it gets into the young athletes piece. So you see that highlighted point there, and I won't go too far into this, but for young athletes, there is I'll even say, you know, there's that pressure at this point with colleges being so expensive and athletes trying to push themselves for scholarships and opportunities and getting into that good school. So there is definitely that pressure for kids, and we hear from our Youth Prevention Coalition members about, you know, playing 3 sports, managing a part-time job, homework, classes. You know, you look at a kid's schedule, and I think it's, you know, just as busy, if not busier, than adults sometimes. And it's good, it keeps them busy, hopefully it keeps them away from substances, but at the same time, it definitely increases stress, you know, and as they're managing multiple sports throughout the year, you know, that can definitely be, that can definitely lead to kind of some of these next few slides. So that this says legitimate opioid use before high school graduation is independently associated with a 33% increase in the risk of future opioid misuse after high school. So again, this is really that connection with the developing brain. multi-sport athletes are shown to have a higher injury risk due to overuse, which I'll get into in a little bit. So all of this really leading to the fact that, and again, the key word there, legitimate. This is not recreational and experimenting as a teen and being out with your friends. This is legitimate opioid use that leads to a 33% increase in the risk of future opioid misuse after high school. So, we can see where this really plants the seeds to potentially future problems. Next slide. So the connection to youth sports. So athletes who play a single sport year-round, particularly high-contact sports such as football, basketball, wrestling, and lacrosse, may be at higher risk for injuries in which an opioid pain reliever may be prescribed. So this really breaks down into two types of injuries. So acute, usually resulting from a single traumatic event. This could be a broken bone, something that will heal and you'll be good to go once it does heal. I would say the bigger issue is really the second piece of overuse. And this is where it gets into, playing sports year round or those multiple seasons throughout the school year. So overuse injuries are more difficult to diagnose and treat because they're usually subtle and occur over time. So this can be, tears and strains, these lingering problems that can lead to, future issues with injury and then also, with opioids as well. So next slide. You'll just see here, I'll quickly go over. So you see there, the most common upper body overuse injuries are shoulder and elbow. I have to say, you look at like high school baseball players at 17, 18, 19 years old coming out of high school with Tommy John surgery. So that is a major procedure that shuts down Major League Baseball players for over a year. But because of that overuse, and you think about, if a kid in high school is playing on their high school team, on a traveling team, taking pitching lessons, you think about the number of times they might be pitching a baseball per week. And I think it's pretty obvious how it can lead to those overuse type injuries. So, it's really where we see the most with the shoulder and elbow. The most common lower body it's usually to the knee. And you'll see there the sports that have the highest rates of ACL injuries. So girls soccer, boys football, girls basketball, gymnastics, lacrosse, soccer, wrestling, field hockey. So, definitely those more contact sports. And I think you can kind of put the pieces together as to how that might lead to some of these overuse injuries or even acute, for our youth in sports. Next slide. So the Connection Youth Sports, a 12-year study by the Children's Hospital of Philadelphia showed a 400% increase in sports-related orthopedic injuries in youth ages 12 and up, mostly from overuse. So injury patterns suggest intensity of youth sports programs and year-round youth sports model to be a factor. These injuries are troublesome for young athletes as they require an intense recovery period and could impair growth. Student athletes will also return to their sport at the same intensity after fully healing, placing themselves at risk of re-injury. And I think bigger picture, this really gets into the culture of getting back out on the field, toughing it out. We're really, if there's a serious injury, especially as youth, their bodies and minds are still developing, it is important that they get the proper treatment, take the proper time off to really heal 100% before returning to this level. And I will say, we've worked with local athletes as part of this presentation in this program. One of them being David Deal, a former New York Giants player. He actually works with the RWJBarnabas health system. He's kind of an ambassador out in the community. And I think the biggest question that we asked him was, did you only play football growing up? And his immediate answer was like, no, and I don't recommend that. You're only working on certain parts of your body. It puts you more at risk for these overuse type injuries. So I think he said he played football, wrestling, and baseball in the spring. So spreading it out, again, not focusing on one area of work or that potential of overuse. And I think, he kind of preached how it made him a better athlete and a better overall athlete. So it's really important to give that variation a little bit, as kids go throughout the year. So, but again, really the important part, allowing kids to heal properly. So we don't have to worry about that brain development and how opioids are impacting that long term. Next slide. I think Abby is ready to take over.
Sorry, had to unmute myself. Yes. So one of the other things that we wanted to talk about, and I think this is kind of like the age-old issue when it comes to looking at teenagers and substance use, and kind of just something that is pervasive and continued, and but something that we still need to address, because oftentimes when we look at survey numbers for prescription drug misuse, the numbers for kids in middle school and high school are minuscule. It might be something under 1%. And of course, there definitely is use and there's misuse. And then we also see a really sharp increase in that use when we jump from, under 18 to 18 to 24. So it's not to say that we don't need to address that, but where we see consistent and high numbers is always with underage drinking and use of alcohol. So this is definitely something that we can't neglect. We have to hit all the different topics, but something else that we wanted to talk about, and something that we've also, again, seen take an interesting turn during the COVID-19 pandemic, and really it's kind of shown itself. So one of the things I'm sure you all have seen in the headlines, especially as it kind of comes into news briefings and things along those lines, is as restrictions have been lifted in our state, we've seen a really big increase in house parties. So there was a house party with teens in Middletown. There was a pop-up house party with 300 people, a party with 700 people, parties with 500 people. There are really some very large gatherings going on. A lot of that is, kind of going along with drinking and alcohol consumption. And one of the most interesting ones, and this was in early July, was in Middletown. And there was a house party. It was largely teenagers. And there ended up being 65 cases that were tied back to that party. And most of those who were sick were between the ages of 15 and 19. And they were having a lot of difficulties doing contact tracing because people were so hesitant, and parents were hesitant and kids were hesitant because there was underage drinking going on at this party and people didn't want to be held liable. So it kind of is interesting that no matter what place in the world we're in, this is something that is still going on. But I think it just kind of speaks to larger community norms surrounding underage drinking, especially when we look at high schoolers compared to middle schoolers, and kind of what parents allow, what communities allow, and what kids' perceptions are on this use. So when we look at where do our youth get our alcohol, I'm sorry, this was supposed to have a transition in a second. So this is all information, the data that you'll see over the next couple of slides. It comes from a 2018 Youth Prevention Needs Assessment Survey that we did in our area. So these are numbers actually from kids in New Jersey, not necessarily, nationwide numbers, which we often get. So when you look at these numbers, 50% of kids said that they got it from somebody 21 or older. 33.6% said it was under 21. That somebody gave it to them. 37% got it from a family member or a relative other than their parents. But then I want to draw a special note to the bottom two. So 34.5%, and this was equal for both, and they were allowed to select more than one option, said that they got it from home with their parents' permission or without their parents' permission. So when we really kind of take a look at that, we not only are they getting it from family members or relatives other than parents, potentially older siblings, but it also could be coming from within that child's home. And again, this is where kids say they're getting it from as compared to, our perceptions of, oh, well, they're going into a store and they have a fake ID and buying underage, even though their ID says they're 21. A lot of it is really coming from the homes that they frequent, or the individuals they know, as compared to them going into a liquor store themselves and buying it. I saw a chat box, I didn't see it. All right, so the next, so where do our youth drink? So the question on here was, during the past year, did you drink alcohol at any or of the following places? So some of their options included at their home or someone else's home without parent permission. So again, this kind of ties into where they're getting it from. Over half of the kids said yes to that. At home with my parents' permission. Again, over half of the kids said yes, that it was at their own home with their parents' permission. And then finally, the other option that had quite a few responses was at someone else's home with their parents' permission. So it is, depending on the town that you are in, there are additional ordinances that kind of regulate if a parent can provide alcohol to their child within their own home, if it is to their own child. But again, when we kind of take a look at this, there are other parents who are providing children that are not theirs with alcohol, and this really kind of just speaks to that larger conversation that we need to equip parents to have and navigate with their kids, and conversations that we need to even have. I am not a parent, but just kind of having conversations with your fellow parents or the adults that you work with about this. It's really important because this is absolutely going on and might be going on without that child's parents actually even knowing. If, you know, they're just going down the street to hang out, this can occur. So when we take a look at kind of something else, so not only where are kids accessing alcohol and how are they accessing, but looking at youth perceptions on alcohol is another one of our major indicators. So the kids in the survey were asked, how many students in your grade do you think drank alcohol sometime in the past month? So the ones that I want to draw special attention to are that half or more, so the bottom half of this table. So almost 75%, so 3/4 of these respondents, and these were seniors, where again, we kind of see the highest rates of alcohol consumption based on age, things like prom, graduation, kind of the rite of passage as kids get older, all those different community norms which drive alcohol consumption. These respondents, over half of them, or 75% of them, thought that at least half or more of their peers were drinking. So this kind of ties in with that, well, everyone's doing it, or, you know, the peer pressure that comes along with that, how it's glamorized on social media, posted, things along those lines. There's really this perception that everybody is doing it. However, when we look at the actual number of kids who report that they are drinking, and this is self-reporting, and again, if we look at 12th graders, 42.5% of kids are saying that they actually do consume alcohol. So less than half are consuming, but their peers believe that at least half are. I know it's a little bit confusing in the way I'm phrasing that, but essentially there's a discrepancy in the perception of kids and how many of their peers they think are drinking as compared to how many really are. And this is absolutely a factor that drives those community norms and youth perceptions and that potential use of alcohol. And then we also take a look at parent perceptions, because this is something else that drives kids and their decision of whether or not to use a substance. That goes for any substance. But we know in prevention science that if a parent or guardian has strict, conversations and kind of their own house regulations and expresses their own opinions on different substances, including alcohol, that a child is less likely to do that if their parent expresses disapproval. So this is information that comes from our community survey that we do through the Dark Prevention Coalition. And we asked the folks that we surveyed if they were aware of neighbors or other adults who allow underage drinking in their home. So almost 40% of those who answered said that they are aware of neighbors or other adults who are allowing this in their home. So this kind of comes out when we think back to the stats that we saw earlier about where kids said they're getting alcohol from, whether it's their own home or a friend's home or a friend's parents, somebody else over the age of 21, that this is absolutely going on in our communities and our neighborhoods, and that this really can kind of impact that perception around alcohol use when it comes to community norms. And if kids see this as something that's going on, that's kind of one of those factors that continues to drive the perception that, yeah, it's okay to use, or my friends are doing it, or, all the neighborhood parties, everybody's drinking, that this is just kind of how it is. And that really impacts their potential for use. So something else, and again, kind of going back to the pandemic, and we have to ask ourselves, what are we teaching our children or the youth that we work with about alcohol during our time at home? So, and this is not to say, and we want to be cautious with this, we really are talking about kids here. We were talking about kids and youth, individuals under the age of 18, 21 when we're talking about alcohol. in regards to this substance use. It is absolutely, if somebody's over the age of 21 and consuming alcohol responsibly, that is not what we are getting at here, but it's kind of just looking at the larger perception that these habits may show or this action may show to the children in our home. So during the pandemic, alcohol sales skyrocketed. So during the week of March 21st, and this was nationwide, and this is really kind of when things went into lockdown, like the majority of the country kind of, it was going to be you're at home indefinitely or for at least a long period of time. They skyrocketed by 55%. Spirit sales increased by 75% during the same time frame, and beer sales increased 66%, with wine going up by 42% compared to that same time frame in 2019. We also saw an increase in online sales. So there are a lot of different companies where you can go online and purchase different, beverages, and that went up by 42%. So there definitely was an influx of these products coming into people's homes. I saw quite a few memes and jokes on Facebook and Instagram about quarantinis and, the need to pour a glass of wine in order to get through, my job for the day, or my Zoom calls, or homeschool, or, virtual learning, things along those lines. So all of these things kind of tie back together and show the children that may be in our home that, this is kind of a way to deal with the stress or deal with anxiety or deal just kind of with the boredom that comes along with being locked in. So again, it's not to say that this, consumption by somebody who's 21 or over, when it's done responsibly, is absolutely that adult's decision. But I think it's just kind of important to kind of reflect on what this shows the kids in our lives and kind of what it shows them in terms of how they may choose to cope with the similar stress and anxiety and just kind of confusion that they're feeling as well as we go through this pandemic. So what is an adult's role in preventing underage drinking? These are just kind of some takeaways. And again, things to encourage you all to do yourselves or with your, your fellow parents, family, friends, things along those lines. Talking early and often. So this is something that's really important, and of course in an age appropriate way, but it's not really necessarily ever too early to kind of have that conversation. And again, we know that parental or guardian opinions about youth drinking and other substances are really important and one of the best indicators of a child's decision of whether or not to use a substance. And with this, you can establish policies for your household early on. And it's also really important to be consistent in setting those different expectations and enforcing the rules. And this kind of goes for, if you have children of different ages, and ensuring that you're setting those standards and following through on them. And again, also work with other parents to monitor, where kids are gathering, what they're doing, and being transparent with them and saying, I'm not okay with you providing alcohol to my child if they're in your home. I'm not providing it to your child if they're in my home. It's more than valid and fair to have that conversation. You can also work with the community, get involved with PART or your local coalition or different organizations to promote dialogue about underage drinking and what we can do to address it as a community. And this really ties in with those community norms and what that shows kids. Be aware of laws about providing alcohol to your own children. And then also never provide alcohol to someone else's child. Kind of simple as that is something else that we can do. All right, so I'm going to turn it back over to Mike to wrap things up.
Yep, and just real quick, I see someone in the chat asking for the information. We can definitely share this. Also the recording, just give us a few days. It will actually be posted to the RWJBarnabas YouTube channel as well. Just so you can kind of hear the dialogue as well. But we can definitely get this out to everybody. Sometimes we have issues with file sizes, so we can work through that. But if you just reach out, we can get that over to you. Another comment with regards to what you said before about buying alcohol online. I wonder why that is legal. There's no way to check ID on the internet, so it is very easy for underage kids to buy. That's a great point too. Abby, please chime in. But especially with apps, I know there's Drizzly and some other alcohol delivery services, and while they are supposed to check ID when they deliver or not hand it over to somebody clearly underage, I just, I think there could be issues with, the delivery people actually following that. And I think we've kind of had these conversations the last few years, like, hey, you know, for a delivery person working and relying on tips, you know, obviously it's important to make the customer happy. So that's a great point. You know, the legality of it, and then also, you know, like you said, the physical drop off as well. So, you know, if a kid answers the door and says, "Oh, my dad's upstairs, but I'll grab it," you know, who's to say if the person's going to hand that over or not? So it is definitely a challenge, and makes it that much easier for youth to access alcohol. So thank you for that point.
Yeah, and I think the same thing is one of the concerns that we had when it came to the purchase of vapes online, because you could kind of get them delivered from anywhere. You didn't have to go to a brick and mortar store, and the ID checking process. So this is definitely something that is kind of completely unregulated to some extent when you're looking at the web, and depending what platform you're on. I know that some companies require you to scan an ID, take a photograph of it, but also what's stopping somebody from, you know, taking the ID from their parent or an older sibling, something along those lines. And I think that it's also, and Mike, I'm not sure if you're talking about this in this next little bit, but something else that we've talked a lot about is outdoor dining and having drinks, you know, kind of as you can go to a bar and have takeaway drinks and bring them home. And kind of what that community norm also says and shows kids that this is something, you know, you could kind of just, you don't even have to buy food at first, that restaurants and bars were allowed to do that. So it's something else that we kind of have been considering as a prevention coalition, and ensuring that we are helping the restaurants, businesses that we work with figure out safe ways to go about doing this. And kind of navigating this really unprecedented time. When you look at liquor laws and the New Jersey ABC and how they implement different policies in regards to, you know, open containers and distribution of alcoholic beverages. So it's kind of uncharted waters a little bit, but definitely something to consider. So thank you.
All right. So this is just to kind of wrap up. You know, we appreciate everyone's time. This information on the next few slides, it's from an article focusing on, Abby, you can jump to the next one, actually. You'll see this is the headline right from the article. So when a pandemic and an epidemic collide. So while this focuses on opioid use and the opioid epidemic, I think any of the topics we talked about today and any other substances, you know, it really is relevant for that as well. So, but basically, you know, the whole idea of the article, it took a look at, you know, the stressors that may increase use, may unfortunately cause people to relapse, and really applying that to the current pandemic situation, and really, you know, the environment and the dangers that sets us up for. So some of the factors that typically fuel substance use are heightened. So stress, anxiety, loneliness, and isolation. I mean, that's obviously a huge one, as we were all asked to stay home for such an extended period of time. Financial problems and job loss, another huge one. You know, the extended period of job loss and companies not rehiring. So that's obviously a huge factor as well. Uncertainty, really, you know, even still as a state and as a community, you know, what this looks like for the next 6 months, the next year. That is another factor that can fuel substance use. And changes at home. That could be, you know, job related, family related, health related. So, you know, these are some of those factors that are known to cause increased substance use. Next slide. So this is kind of overall, and I'm glad that Abby got into some of the specifics, especially during the beginning of COVID-19 and the stay-at-home orders. But overall, alcohol sales have risen 25%. And again, you know, that is it's an indicator, but there's also, you know, adults over 21 that are responsibly drinking alcohol at home. So that is sort of one piece to it. But I think what is an incredible number to look at is the second point. So the recent analysis of 500,000 urine tests showed a 32% increase for non-prescribed fentanyl, a 20% increase for methamphetamine, and a 10% increase for cocaine. So, you know, this is definitely more than just people thinking, hey, I have more time on my hands, I'm relaxing at home. You know, what's the difference if I have a couple more beers or drink a little more frequently? this is really getting into some serious stuff when we see here with fentanyl and methamphetamines, things like that. And overall, and I think this, our prescription work group for DART and any members that are on the call today, I think this is what we talk about in every meeting. And it puts some numbers and some structure around what we were surmising the last few months. But, we were hearing those stories from community members and first responders and law enforcement that overdoses are climbing because people are home. Again, those factors that I just talked about are increasing and more apparent than ever. But this really puts a number to it. So this is nationwide, but suspected overdoses climbed 18% between March and May. So I would love to see updated numbers on this in the near future, because unfortunately, I wonder if this continues to go up as our numbers are coming down COVID related here in New Jersey, but obviously the lingering issues of job loss and health concerns and things like that, they are continuing, as they have been the last few months. So I have a feeling, unfortunately, this might be going up and up and up right now. So next slide. And then I believe this is actually the last one before we wrap up. So this was really interesting from a medical side. So patients were reluctant to seek treatment in medical facilities during COVID-19. And I think that's something that we even heard within our own hospital system. Some of our ED doctors and nurses were saying that they would go a whole shift and they would only treat like two patients, non-COVID related. So people were reluctant to access those services even when they might be needed. Treatment facilities had to limit services or had to close altogether. They just couldn't meet the needs with social distancing or sterilization, things like that. So unfortunately, for a period of time, they had to close their doors and not provide those services. People with substance use disorders sometimes turn to new and unfamiliar dealers or unfamiliar drugs, leading to increased overdoses and death. Kind of gets back into what I said with fentanyl. Dealers may want repeat customers, but if that is not available and you're looking to buy, you may turn to somebody you're not familiar with, and who knows what's in their product. And that could really be one of the contributing factors to the increased overdose numbers that we see. And this also, the last point there relating to the stay-at-home orders, people have been overdosing alone more with no one nearby to help, including administering Narcan. So again, I am a huge believer in Narcan, but that is the immediate answer. That is overdose prevention. That is not substance use prevention. That does not help with recovery or recovery support services. So that is one piece to a much larger puzzle. But during this time, obviously, if people are following those orders, staying at home, they're potentially using these substances by themselves with no one there to help them if, God forbid, they do overdose. So I think you can kind of see how all these pieces, the water starts to boil over kind of, when you put all these pieces together in terms of how people are feeling during this time, turning to unfamiliar dealers potentially, being by themselves more, lack of treatment services available right now. It all kind of, it lends itself to that bigger problem that we're seeing in our community. So, I think when it comes to, just kind of sum up, when it comes to trends, I think this hits the nail on the head, just with substance use disorder as a whole. I know this focused a bit more on opioids this end part, but I really think it paints a picture of what our world looks like now. And I think it really emphasizes the importance of continuing to advocate for these services and, supporting those with substance use disorder in their journey to and through recovery. And I think this is obviously something, even if the pandemic winds down in however long, 6 months, a year, 2 years, I think these are really going to be some lingering issues that we'll see for years and years to come. So it's important to stay up to speed, be aware of what's going on. I thought this article was such an insightful look at it. Is that Abby giving me the hook going to the next slide? I'm joking.
No, I'm sorry. My screen is not happy right now. I don't know why. Technology.
That's what mine was doing before too. So again, I apologize that my my computer dropped off before, but I'm glad I was on my phone as well. So, and we will, just seeing some comments, we will put the link to the evaluation in the chat. But again, thank you all. Just want to read through Janine's comment as well. Not sure. Do you consider steroid use among youth and or athletes an opportunity towards future behaviors, towards other abuses? There is definitely that connection. I just think that I know student athletes are typically screened for steroid use, at least like in the beginning of the season. So that is not, I would say, a huge trend that we've seen. But the question that you're asking, I would absolutely say that there is a connection between those two if anyone is, you know, using steroids as a high school athlete. So is there a need to make their use or abuse a consideration for trending? Yeah, and I know we've had materials on steroids before. We've distributed those to schools and our work with young athletes. So the information's out there, but like I said, thankfully, it doesn't seem to be a huge problem. So thank you for the comment, though. With that being said, we do appreciate everyone's time. You know, this went for the full hour and a half. If there's any other questions, please put them in the chat box. You'll see there also, we do have other webinars in our series. I don't know if we can put that link in the chat box as well. There are ones upcoming over the next few weeks, so we encourage you to join us for those. There are actually some that will be done multiple times, so you know, don't get confused. There are multiple offerings of the same webinars.
And we'll also be giving Department of Education CEUs for all of the webinars. So for today, you'll get your certificate for an hour and a half, and then also for all of those to come. So if you have colleagues, friends, coworkers who are interested in any of the topics, please feel free to circulate them. We can have up to 300 people on the calls and still have some more room. So we tried to kind of, you know, create topics that were relevant to right now. A lot of them are geared towards educators and school personnel, and just kind of things that we surveyed school personnel and staff to find out what you all were interested in, and really kind of tried to put together some information that would be helpful for you all. So we will drop that link into the chat box, like Mike said, and you will also get a follow-up email with that link to register for upcoming webinars, as well as the slides from today. So if there are any questions,
sorry, go on. That's what I was going to say.
No, that's okay. Any questions or comments or anything, you can unmute yourself, or if you wanted to type them in the chat box. I know that we've had some questions throughout, but also feel free. This is mine and Mike's contact information. So you can shoot us an email, and we will also follow up.
Yep. And again, encourage anyone that's interested to stay for the DART meeting. It's just going to be some short updates, but you know, this was really the training portion for our DART members. So, and we encourage anyone. DART is specific to Ocean County, but if you go, there's a counterpart like DART that covers every county in New Jersey. So, if you go to the New Jersey Prevention Network website, njpn.org. They have the full contact list, and you know, we really encourage everybody to get involved. For those that are from the school sector, you know, it's such an important voice to have on the coalition, since so much of our work impacts youth, and you are such an amazing source of information for that. So you know, we do encourage you to get involved in your local regional coalitions. And Abby just put the link for the other webinars in the chat. So we'll just give it a minute or two for those that do want to drop off. That's fine too, and then we will we'll get the DART meeting started. And I'll try to fix my computer problems.